Welcome to our in-depth look at hypothermia, an often overlooked but potentially life-threatening condition. Let's begin by defining hypothermia. It occurs when the core body temperature falls below 35 degrees Celsius or 95 degrees Fahrenheit. Unintentional hypothermia is a significant cause of morbidity and mortality, accounting for around 1,500 deaths each year in the United States alone. The elderly, particularly those over 65, are at higher risk and face higher mortality rates. So what causes hypothermia? Broadly, there are two mechanisms: increased heat loss and decreased heat production. Increased heat loss can happen with environmental exposure. Think cold weather, avalanches, or submersion in cold water. Certain substances and conditions, like alcohol, vasodilating drugs, or carbon monoxide poisoning, also lead to induced vasodilation, accelerating heat loss. Vulnerable populations, such as the elderly, people experiencing homelessness, or those with low income, are especially at risk during winter months. On the other side, decreased heat production can stem from endocrine disorders, hypothyroidism, hypopituitarism, adrenal insufficiency, or hypoglycemia. Neuromuscular inefficiency, whether in the very young or very old, or due to burns or extensive skin disease, also reduces heat generation. Finally, impaired thermoregulation in sepsis or after major trauma can leave the body unable to maintain its temperature. To guide assessment and treatment, clinicians use the Swiss Hypothermia Staging system, which divides hypothermia into 4 stages. Stage 1, or mild hypothermia, with a core temperature between 32 and 35 degrees Celsius, 90 to 95 degrees Fahrenheit, where patients are shivering but awake. Stage 2, moderate hypothermia, between 28 and 32 degrees Celsius, 82 to 90 degrees Fahrenheit, where shivering continues but mental status becomes depressed. Stage 3, severe hypothermia, from 20 to 28 degrees Celsius, 68 to 82 degrees Fahrenheit, where patients are unconscious and no longer shivering. Stage 4, profound hypothermia, below 20 degrees Celsius, 68 degrees Fahrenheit, where no vital signs are detectable. Clinically, hypothermia affects multiple organ systems. Cardiac manifestations include progressive bradycardia, which can advance to atrial fibrillation, ventricular fibrillation, and eventual asystole. On ECG, you may see Osborn or J waves. Although these have no prognostic value, dysrhythmias become more likely once the temperature drops below 30 degrees Celsius. Coagulation is also impaired. Platelets dysfunction and the clotting cascade slows, contributing to the lethal triad of trauma: hypothermia, coagulopathy, and acidosis. Other complications include the afterdrop, where both core temperature and mean arterial pressure continue to fall during rewarming, an increased risk of thromboembolism due to hemoconcentration, an impaired drug metabolism and absorption because of reduced gastrointestinal motility and peripheral vasoconstriction. Patients can develop acid-base disturbances, aspiration pneumonia, and rhabdomyolysis. Accurate diagnosis requires a low-reading core thermometer, often an esophageal probe, if the patient is intubated. Always check blood glucose, as it can be falsely high or low in these patients. A potassium level above 10 to 12 MEq/L is generally incompatible with life. Be aware that lab values may be misleading if samples warm up before analysis. Obtain an ECG to assess rhythm and look for Osborn waves. Management follows a few basic principles. Handle the patient very gently to avoid triggering ventricular fibrillation. Provide oxygen, since hypothermia shifts the oxyhemoglobin dissociation curve to the left. Intubate carefully, understanding that medications will act more slowly. Warmed isotonic saline is the preferred IV fluid. Avoid lactated ringers, with dysrhythmias often resolving simply with rewarming. Defibrillation can be attempted if indicated, but may fail until the core temperature exceeds 30 degrees Celsius. In special situations, additional medications may be needed. Give antibiotics if you suspect sepsis. Administer thiamine in chronic alcoholics or if Wernicke encephalopathy is a concern. Provide hydrocortisone for adrenal insufficiency, and consider levothyroxine if hypothyroidism is suspected. Rewarming techniques depend on the stage of hypothermia. Stage 1, mild, passive external warming. Move the patient to a warm environment and apply blankets. Stage 2, moderate. Active external methods such as forced air warming blankets or warm water immersion. Stage 3, severe. Active internal rewarming, including warmed IV fluids, gastric or bladder lavage, extracorporeal membrane oxygenation, ECMO, or dialysis. Stage 4, profound. Combines active internal methods with modified ACLS protocols. Always rewarm the trunk before the extremities to minimize afterdrop. Passive external warming raises temperature by about 0.5 degrees Celsius per hour. Active external methods achieve 1 to 4 degrees Celsius per hour, with water immersion being the fastest. Active internal techniques like thoracic lavage or cardiac bypass can increase the temperature 7 to 10 degrees Celsius per hour. ECMO and bypass are reserved for the most profound hypothermia or cardiac arrest. When a hypothermic patient goes into cardiac arrest, confirm the absence of a pulse for a full 30 to 45 seconds and avoid unnecessary CPR that might induce ventricular fibrillation. Use a modified ACLS approach. Limit defibrillation attempts and withhold epinephrine until the core temperature is above 30 degrees Celsius. Terminate resuscitation if the potassium is greater than 12 mol or if a systole persists in a patient over 32 degrees C. Finally, disposition depends on severity. Anyone with moderate to severe hypothermia should be admitted to the intensive care unit for continuous monitoring and advanced rewarming support. That concludes our comprehensive overview of hypothermia, its causes, classification, clinical features, diagnosis, and management. Stay safe, stay warm, and thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more medical education content.